What is medical ethics? Medical ethics is a field of applied ethics that guides how doctors, nurses, and other healthcare professionals ought to act when caring for patients. It helps answer questions like, what is the right thing to do? What is fair to the patient and society? How should doctors act when values or interests conflict? The four classic principles, Beauchamp-Childress framework, often taught are the four pillars of modern medical ethics. Autonomy, respecting the patient's right to make decisions about their own body and care. Obtaining informed consent before surgery. When considering this principle, doctors need to state all the possible outcomes to patients or their caregiving families. This is often not the case. A common situation in this regard is the doctor's fear of driving the patient away by listing treatment side effects that can be permanent or disfiguring or downright deadly. The very reason this fear exists in a doctor's mind is that other doctors in their area likely list out only the mild complications of a treatment or procedure, withholding the chance of permanent damage or death. Also important in this regard is that patients and families on their own side need to understand that finite risks exist with almost every treatment, as they do with simply taking a walk or a vehicle to the bazaar. Beneficence, acting in the patient's best interest, doing good, recommending a treatment that offers the best chance of recovery. This means that the doctor must recommend the treatment with the best probability of healthful outcomes for the patient, withholding recommendations based on personal comfort and experience alone or for monetary profits. Is this really being followed by all doctors? Non-maleficence, do no harm, avoiding unnecessary risk or harm, avoiding a surgery that has more risk than benefit. And finally, justice, treating all patients fairly, considering the fair allocation of resources. Doctors need to prioritize patients based on clinical need, not wealth or status. And does this really happen? Among the biggest healthcare controversies is the disparity in the quality of healthcare between affordable public institutes versus costly private and for-profit hospitals. Additional important concepts in medical ethics include confidentiality, keeping patient information private; informed consent, ensuring patients understand risks, benefits, and alternatives before agreeing to treatment; veracity, the duty to tell the truth; fidelity, keeping professional promises and commitments; and professionalism, acting with integrity, compassion, and respect. And why does medical ethics matter? Medical ethics helps doctors and patients navigate difficult choices such as high-risk surgery, end-of-life care, conflicts. For example, when the patient wants treatment the doctor feels is futile, and broader issues like resource allocation, experimental treatments. Medical ethics keeps the focus on what is right for the patient, not just what is technically possible. Unfortunately, medical ethics is neither stressed in the current medical curriculum nor is it thoroughly tested on medical students' exams. Is this perhaps the reason why patients are frequently skeptical about the healthcare system? Our effort here is to increase public awareness about these issues so that this ultimately translates to a safer healthcare system for patients and people in general.